Hi, my name is Haley and this is my NG tube skill. So first I would check the medical order to make sure we get the right tube and make sure that the order is placed for the patient. And then I would gather my supplies and get the right tube and match it with the order. So I would move into the patient's room, knock, perform hand hygiene, ask the patient their name, date of birth, check their wristband, and provide for privacy. So upon going in their room, of course, hand hygiene, and then I would tell them that today we are going to do the NG tube and explain to them why and explain to them how it's going to go, that there shouldn't be any pain, but there is some discomfort, and just reassuring them that it's going to be okay. So I would grab their side table and move it over to make it accessible for me to put my supplies on, and I'm going to put their bed up to waist height and put them in a high phallus position. If they couldn't sit up straight, I would put them at a 45-degree angle. So then I'm going to put my equipment on their bedside table. I'm going to perform hand hygiene again, and I'm going to drape the patient on their chest. I'm going to give them a basin and some tissues because there might be some watering of the eyes and some gagging. So then we're going to measure the tube. So to measure the tube, I'm going to take the end of the tube and put it to the tip of their nose and then to the tip of their earlobe. From the tip of their earlobe, we're going to go to the tip of the xiphoid process. And then from there, according to facility policy, we would add 10 centimeters. So from there, add 10 centimeters, okay? And we will mark that with our Sharpie. Okay. All right, and then I'm going to perform hand hygiene again and put on some gloves. I'm going to take my tube and we're going to lubricate it 2 to 4 inches right here at the tip, and then explain to the patient that they have to tilt their head slightly back on their pillow, and we're going to go in an upward backward motion till we reach the pharynx, and there might be some watering of the eyes, and we would provided tissues for that. So we would have the patient take a deep breath. We're gonna go in, and to select the right nostril, I would have them breathe. Hold one side and breathe, hold the other side and breathe, and whichever side they breathed out better, we would choose that nostril. So this one, we're doing the left side. Once we reach the pharynx, we're going to instruct the patient to put their head to put their chin to their chest, and we're going to go downward and backward. We're going to tell them that they need to keep sipping on the water. We're going to provide them with a glass of water and tell them to keep sipping through the straw. And if they breathe, we have to stop and if there's any persistent coughing or gagging, I would take a tongue blade and a flashlight and make sure that the tube is in the right place. And if there's any curling of the tube, we would straighten it out, and the tube should not be forced. We would also discontinue the tube if there was any distress, coughing, gagging, unable to speak or hum. So then, while they're sipping on their water, we're going to push that tube in just till we reach that marking that we had. So once we have reached the marking, and grab our tape, we're going to loosely secure it. Okay. And I'm going to get the piece that we will use when we secure it, completely secure it. I just wanted to get it ready, and I'll put that on the side here. So to make sure that this is in place, I'm going to mark it again right at the nose where we're at. We're going to get an x-ray to make sure that the tube is in place. Also, I'm going to take my syringe here and get some of the contents out of the stomach. So, some of this out. Okay, and then I'm going to take my pH strip and put a dab on that and compare it to the pH chart and make sure it is around 5.5. And then after that, I will remove my gloves, perform hand hygiene, and then I'm going to measure our tube from the nose down. Okay. And then I'm going to take this piece of tape off and take the one where we made a slit in it. But we're going to put the big side on the nose, and then we're going to crisscross around that tube with those two pieces. And then I'm going to mark that placement again. Alright, and then I would instruct the patient to turn their head opposite of where the tube is. So I'm going to take a piece of tape and put it around that tube. And then I'm going to take a safety pin and put it through their gown and through the piece of tape to secure it to their gown. And then I would clean up my area and ask the patient if they had any questions. I would tell them that we would be back every 2 to 4 hours to perform oral hygiene, and we have things to give them to keep their nose and their mouth and their lips moist if needed. And I would perform hand hygiene, put the bed back down, put them in a comfortable position, and I would go chart my findings in with the stomach contents, how the patient took the procedure and that we had done it, and make sure writing down all the measurements. And that should be it.